Just yesterday, Kenneth Smith, an inmate at an Alabama correctional facility, was executed using a brand new method involving nitrogen. I'm Dr. Hassan. I'm an anesthesiologist. I use nitrogen and oxygen every single day to keep patients alive. I'm going to give you my take. You might not agree with it. Now, before we get started, it's about 9:05 in the evening. I would really appreciate it if you guys could do me a favor and please like and share. I try to put these videos out in between working full-time, being a parent, and husband, all those kind of things. So I'd really appreciate it if you guys could share and like and do all those things just to grow my channel. Now, Kenneth Smith was an inmate that was accused and convicted of a murder back in 1988. This was a murder for hire plot from a husband to a wife, which included stealing a VCR, which ultimately ended up convicting him years down the road. Now, the interesting part about this is Kenneth Smith actually survived his initial execution attempt back in 2022 when they botched the procedure. His attorneys argued that doing this again would be cruel and unusual punishment, and you can't really try it twice. However, this appeal went all the way up to the Supreme Court, and the Supreme Court denied it. Now, let's put aside the fact that what he did was egregiously wrong. Murder in any situation is not correct. And obviously, our thoughts and prayers are with the victim or the family who passed away back in 1988. Now, the reason for this video is to talk about the execution method, which is brand new, never been done before, first time in Alabama, first time in the United States. There's only 3 states that have actually approved this method. Now, this method involves using a tight-fitting mask which fits across your face, which then cuts off all the oxygen supply and gives only nitrogen, basically depriving your entire body of oxygen. Now, as an anesthesiologist, we use nitrous oxide almost every single day when we're waking patients up from anesthesia. This is not always the case. Nitrous oxide isn't the best anesthetic gas out there, but it is used very frequently by a lot of anesthesiologists, a lot of CRNAs, and a lot of anesthesia assistants across the country. There's also a method that is used to put children to sleep in order to place the IVs in their arms because children don't stay still for you to put an IV in their arm. The nice thing about nitrogen oxide, it's very quick on, very quick off. However, whenever we use it, we always mix it with oxygen. Now, if you've ever had surgery before, you'll probably remember having a mask put on your face and having you breathe the oxygen before you fall asleep. When this mask is fitted tightly to your face, it actually takes all the nitrogen out of your lungs, filling it all the way up with oxygen, doing the opposite of what Alabama did essentially. That's why in the TV shows, when you see somebody put the mask on and the person falls asleep instantaneously, that rarely ever happens. Nitrous oxide is also used inside dental facilities, dental offices, where they put a mask on you to help alleviate some of the pain and make you a little goofy. Now, the reason I'm making this video is not because I'm trying to pass judgment on whether or not it was right or wrong to execute a prisoner who was convicted of murder 35 years ago. The reason I'm making this video is to talk about the methodology behind it. Now, putting a mask on someone's face and depriving their body of oxygen, well, should theoretically end anybody's life. The methods used across the country include placing an IV and having medications injected directly into your blood, which then, cause the end of life. Surprisingly enough, for Kenneth Smith, they actually placed the IV and tried this in 2022, but the IV blew, and that's why he survived his execution attempt. IVs blowing happen all the time in anesthesia. We have to work very quickly to place another one before the medications wear off. Now, there are a couple factors you have to consider when you think about cruel and unusual punishment and whether this is fit for a method of execution. When you place a mask on someone's face, there's always a chance oxygen can get in. If a little bit of oxygen gets in, it can prolong the end of life scenario. You only really need about 10 to 12% of oxygen to, bodily functions. 23% oxygen is what's available in the air that you and I breathe. Placing a mask on your face gives you a little bit more oxygen. Placing the tight-fitting anesthesia mask can get you all the way up to 100% oxygen inside your body. Now, the issue that I have with this methodology is, number one, you can have air come into the mask, but that can prolong the execution process, which probably can be cruel and unusual. Number two, there's probably better and faster ways to end someone's life, which include injecting medications into your IV, which work pretty rapidly within 2 to 3 minutes. And number three, if you've ever seen someone have asphyxia, deprivation of oxygen, it's not a very easy thing to see. Typically what happens is if you have decreased oxygen, like you see in the movies as well, when somebody's oxygen is completely cut off, they start gagging, or what they call is agonal breathing, and their body tries its hardest to suck in as much air as it can. That can be pretty gruesome and hard to watch, especially when they start vomiting and things come out of your nose and your eyes and your ears. The pastor in this instance actually said it was the worst execution he's ever seen. Now, for me as a doctor, all of that seems horrible. But me as a person and society also understands that you have to create some sort of negative reinforcement loop to prevent people from, committing bad acts. So is it something that I would support? I kind of struggle with this a lot because my entire job revolves around providing oxygen for patients while they sleep, especially when they're going to sleep in the beginning. It's actually the most nerve-wracking part of my job is inducing anesthesia, because within about 30 seconds, you need to figure out a way to ventilate the patient, ventilate you, the person who's watching this video, and provide you the oxygen necessary to carry you long enough until we can place the breathing tube into your throat. It's something that's constantly on my mind. Oxygenation is probably the #1 priority in any anesthesiologist, any anesthesia provider's playbook. So when you hear about nitrogen asphyxiation, it always makes any anesthesiologist feel a little bit of anxiety inside. Now, on the other hand, you need to have a deterrent for individuals committing crimes across the country, and you and I both know that crime has been rising across the country because of the lax crime laws that are out there. So I think that more than likely this will serve as a deterrent because of how horrific it is, but also as a physician, it makes me feel a little bit tingly, curly, stomach churning inside. So I'm not entirely sure where I stand on this, but I can say that there's probably better methodologies out there that should be investigated. Now, previously, I've read that prisons across the country, especially those that do executions, do use a lot of the same medications that we use as anesthesiologists, but they basically just don't ventilate the patient. So theoretically, it would be just as painful for the patient whether they're paralyzed when they get the medications or not. The difference is that if your body is paralyzed during the execution process, the viewers and everybody involved probably will not see how much pain or what you're going through. In this instance, it will probably be very visible to anybody viewing or spectating this situation, the amount of pain that the person is going through. Now, the courts have determined that person was guilty and was sentenced to death, so I'm not here to pass judgment one way or another on that situation. The family obviously felt a sense of relief after all of this, but you can't quantify losing your mother. I'm sure they're going through a difficult time as well. Where I fall on this issue is probably somewhere in the middle. I don't think this is the best methodology used, but I do think it's important to have this methodology in order to deter future acts of violence. So for me, I think that more than likely this will serve as some sort of deterrent for especially the amount of coverage and news that it's getting. But I also think that there are probably a little bit more humane ways of doing it. However, does somebody in that situation deserve a humane way of passing? I don't know. What do you think? Do me a favor, leave a comment below. Tell me where you fall on the spectrum. Was it correct? Was it incorrect? Or should they try a different method? I appreciate you guys. I love you guys. I'll see you on the next one.